Well, a surge in cases is making testing even more critical. And there is good news tonight for those who may think they may be sick. Now, University of Utah Health is trading out those invasive nasal swabs for saliva tests. News specialist Jed Bowl joins us live. And Jed, I hear those nasal swabs are not that much fun.
No, exactly. I had one of those coronavirus nasal swab tests several months ago, and it was certainly very uncomfortable. As you've probably heard, they stick a nasal probe, a nasal swab, about as far up into your nose as it will go, and it feels like it's touching your brain. So spitting into a funnel that's attached to a test tube sounds like a real improvement.
The big benefit for the person getting the test is they no longer have to have a swab jammed up their nose that far.
Dr. Adam Barker with ARUP Laboratories says many people are apprehensive about getting a COVID-19 test because they've heard it hurts.
So now they can go in and they can just simply salivate into a funnel, close the cap off, 1 ml, and give it to us, and we're good.
Tests are handed into cars quickly.
So we think it's going to make it that much easier for patients to have a test.
Getting results back in 24 to 36 hours. The saliva test is also less risky for healthcare workers who don't have to stand around in their full PPE quite as long.
Any barrier that we can remove to getting testing is going to help our community control the coronavirus infection.
The saliva test was validated several weeks ago. They conducted trials by comparing results from saliva tests with those who also tested with the nasal swab. Saliva testing caught 5 cases that the nasal swab did not identify.
We actually saw a few patients that we would have missed using the gold standard if we weren't using saliva.
Barker tells me ARUP is currently doing 5,000 coronavirus tests a day. Saliva testing will enable the lab to expand to 15,000 by next week.
We're going to triple the capacity of what we can currently test.
Also sending more than 10,000 tests a day to ARUP clients across the country.
We're making those as fast as we can and sending them out as fast as we make them.
The University of Utah Health has already switched over all of its drive-through COVID-19 testing sites to the saliva testing, although they will keep some of the nasal probe testing around for those who cannot produce saliva and other rare cases where they may need to use the nasal swab. The Park City testing sites also will take several extra days to switch over to the saliva, but that's where they're moving with all of their sites. Guys?
Yeah, saliva test sounds way better than a nasal swab. So good news tonight, Jed. Thank you.